Hello, it's Robin and Kim here with our health chat. Today, we're going to talk to you all, and I had my glasses on to cover up my baggy eyes. No, I'm kidding. We're going to talk about sleep or sleep deficiency or a lack thereof
Mm,
and what it can do to us. And guys, people think it's funny. Back in the day, people used to wear like non sleep as a badge of honor. And it is not like I can go on 4 hours or I do three. No, it is not good for you. And Kim and I are going to talk to you today about why it's not good for you and maybe give you some tips to help you along the way. And we'll also give you a book recommendation at the bottom of
mm,
this as well.
yeah.
So, sleep deficiency, here's what can happen to you. It's linked to many chronic health problems, including heart disease, kidney disease, high blood pressure, diabetes, stroke, obesity, depression. And I can see where the depression can come in, guys, with lack of sleep. And it's also linked to a higher rate or chance of injury. So,
Mm,
falls, if you're tired, oh, don't look at my nail, sorry. Or wrecking your car. Like, listen, how many times, falling asleep at the wheel, that's not only dangerous for you, but it's dangerous for other people around you. So, Kim's going to go ahead and give us some little tips, and then I'm
yeah.
going to come back in and give you some little personal information. Well, Kim's got personal too for sleep. I
Yeah,
think
but
everybody has a personal story about sleep,
I
right?
think we do, right?
Yeah.
Sleep is one of the best things we can do for our overall health, and it's the most underrated or pushed back or put it on the back burner because we're so active and busy, and our lifestyle just keeps us on the go, go, go. Like we could be on the go 24/7. So, and the other thing is, it's really interesting. What I learned in one of my courses is that, like, women, especially, if 50% of women who have sleep issues could focus on their sleep, um, so many of their other symptoms they're dealing with will clear up. Isn't that
Right.
huge? That's amazing.
Yep.
So, anyway, so I wanted to talk about some things, some good sleep hygiene tips that we can all take to heart. And I know I've been following these because I've had to prioritize my own sleep because I've had sleep issues. I didn't used to, not until my 50s when I was going through menopause and all that fun stuff, that I start to struggle with getting a good night's sleep. So what I found, and these have really helped me as well, but having a nighttime routine is really key, like having a set bedtime and winding down from getting off your devices an hour or 90 minutes before you go to bed, want to be asleep is huge because the blue
Two,
blocker,
even 2 hours, even
2 hours
two
too, yeah,
hours.
even
Yeah.
better. And because the blue light from your device, from your TV, from your iPad, from your phone, all emits the blue light that does not allow your melatonin to release and to make you sleepy and get ready for bed. Oh, you
You
got
can
those?
also, I'm just going to cut in because you can also get blue blocker
Yeah.
glasses. And all of my glasses, like these are my reading glasses,
Mhm.
which will keep it for my phone, but I also have some that I watch TV in. And the other thing is too, if you have an iPhone, there is a blue blocker um,
Setting.
uh yes, setting, and I have mine on that, and I see it come on there every night at like 8 o'clock or whatever, 7 o'clock. It automatically
Where do you
blocks
find?
that.
Where do you find?
Under settings, I
Of
think it's
course.
under
I'm just
settings, yeah. Or you know what, Google it, it'll come up, or YouTube it, and it'll teach you how to do
Thank
it. Yeah.
you. I didn't
Hmm.
know. I learned something. Thank you.
Right.
Really
Yeah.
good. So anyway, blue blocker glasses, and I have blue blocker reading glasses that I use at night. And then having a morning routine as well, and getting sunlight on your eyeballs as early as you can in the morning.
What's that, Kim?
I
What's
know
sunlight?
lately. Yeah, I know.
If you live in Ohio like us, it's tough.
Yeah, it hasn't been very sunlighty around here,
We haven't
unfortunately.
had it for 3 days.
But the sun's out now, which is good.
Oh,
But
well, it's not here.
yeah. So anyway, but having that morning and nighttime routine and the morning routine, and then setting yourself up, not having caffeine like after 2 o'clock in the afternoon, not exercising late because that gets you all revved up and doesn't allow you to relax enough to go to sleep. Some people say it helps them sleep, but more than likely it won't help you. It doesn't help a lot of people. And then sleeping in a cool room is really helpful if you sleep in a little bit of a cooler room. It helps your body to relax and get into that deeper sleep, which is really key. And I like to read at night. That really helps me. And that's helped me. And I track my sleep. I have my Apple Watch that I use, and I like to track my sleep at night to see how deep I've gotten, how many hours and all that kind of stuff. It's really good. And then you can tweak that way. I would personally take magnesium glycinate at night. I take 350 milligrams of that. That helps with sleep and calming you down. And that's really helped me as well. And that's something to talk to your practitioner about if that's right for you. I said avoid caffeine. Alcohol is not your friend at night. It may make you feel sleepy, but it actually disrupts your sleep, so you don't get into that deep sleep. So avoiding alcohol as much as possible, especially before you go to bed. And taking an Epsom salt bath, that's a form of magnesium that also helps to, it's topical magnesium that helps you relax. And it's also good for your muscles too.
That's what I was just going to say. It's so nice for your muscles. Yeah.
Yeah. Yeah. So I feel like that it's prioritizing our sleep is huge for our overall health. It's like giving your brain a bath and let your brain relax. Your brain's still working, it's still turned on, but it's like, it's not hyped up like during the day when we're on high alert. So that's a pretty neat thing too. So taking care of your brain means also, sleeping well, really prioritizing sleep so your brain health is top notch. So Robin, you want to share your story?
So the only thing I would add extra, and it's things that have like impacted me myself, and I can tell you from my experience, exercise.
Mm,
You get to exercise. The more you exercise, it's going to make you tired and sleep better. Because of my shoulder, I wasn't able to exercise, and my sleep, I mean, besides, having to sleep on my back and everything else, but I know that was part of it. I had no release um, to get my body, tired enough to make myself sleep well. So, but now that I'm back exercising again, I can feel that my sleep is coming back a little bit better. The other thing that I would add, you talked about your room being cool. It's also good to have it as dark as you possibly can have it. And I'm not going to say these are things that I do. These are things that I struggle with because I like to have a little tiny bit of light just so I don't trip going to the bathroom or whatever, or wearing a sleep mask. I'm not a big sleep mask person.
I
Do
know.
you? I haven't found one that doesn't touch my lashes. So if you have a good brand, I would love to know the name of it.
The one I found, the one I'm using, you're gonna laugh. It was on one of our overseas trips, where they give you the little packet of
Yeah,
the little kit. And it's a sleep mask from that. And I love it. It's loose enough. It's not super tight,
yeah,
and it's loose
yeah,
enough. The only thing is it's not silk. And I heard silk is the best to use. I did order
right.
one, but I'm not happy with it. It's like too tight around my face.
Yeah, see, it's hard to find a really good one. So if anybody out there knows a really good one that's silk and that it's loose, I would love to know because I would sleep with one if I could have it be comfortable. And then the other thing is, and I do this one, is if you diffuse like jasmine and lavender.
Mm.
Jasmine is shown to help mellow your body down, and it smells really good. It smells like flowers or spring. So I mix the jasmine and the lavender together. And then I do try to get up and, I think about it. Let's just put it that way. If you're like me, you think about going to bed at the same time every day. And then I just tend to not, and I get off of that phone too.
You know what else I was going to say, Robin? I forgot to say this, and this is what I did and helped me. Because I'm a big water drinker, and I would drink for the morning to
mm,
before I went to bed. I even have a water by my bedstand and drink it in the middle of the
yep.
night. And then I thought I was getting up every night to go to the bathroom. So
Yeah.
I thought I heard somebody did this, and I thought I'm going to try it. So I stopped drinking at 7 or 8 p.m. And lo and behold, I get all my water in up to that time. Lo and behold, I never get up anymore to go to the bathroom.
Right.
Isn't that
Yeah.
crazy?
Yeah.
So
That's
it
good.
really, yeah, it helps. That's what's helped me, because I'm like, I am so protective of my sleep now, even more than I
Yeah.
used to be. And I just realized, and some people say, oh, you'll sleep when you're dead. Well, you'll be dead sooner,
Exactly. I mean, and I like it. really does make your stress levels go up, because I know it puts me in a really bad mood. And when
Mhm.
I'm in a bad mood, like, your whole body is just like this, and that's stress.
Yeah.
So, yeah, I mean, meditate, maybe do a meditation at night before you go to bed. You use a sound machine.
Mhm.
I know I was using white noise, and I'm seeing this cellular health doctor, and she said to try brown noise. So I've kind of switched to the brown, and I like it.
What's brown noise?
I feel like it's not as high pitched as white noise. So
I don't hear anything.
you don't hear it here.
Where's your speaker on your?
I I don't know.
Okay, well, we can Google that. We can Google brown noise.
Anyway, yeah, so try brown noise, and I feel like since I started doing it that it's I've been sleeping sounder. I don't know. I could be out of my
Well,
mind, but I don't care, because I've been missing that full night's sleep.
yeah.
All right, and I'm sweating, so we gotta talk about this
Oh,
next thing
yeah.
we are gonna
We have
talk
something
about,
else.
because I'm
Yeah. Yeah.
sweating. So Kim and I, get your sleep. That's the main thing, and we have a book recommendation from it's called Sleep Smarter by Sean Stevenson, right?
Stevenson.
Stevenson, yeah,
I
yeah,
should have brought it.
and
Mine's
that's
upstairs.
okay. I know. We'll link it. We'll link it in here, and it's got some really good information. Other than that, we kind of wanted to tell you what was coming up. Kim's going to be by herself next week in the kitchen. Kim in the kitchen next week. So tune in to see what she's going to make. And then we're going to talk about it's a blood pressure month. So we're going to talk about blood pressure and stroke the
Mhm.
following week. And then the week after that, we're going to talk about safe sun. It's Safe Sun Week. I'm looking at my calendar because I have it written down. And actually, Monday was Melanoma Monday. So it's because Memorial Day, is coming up this month, and summer is on the way. So we want people to be very cognizant, and that's why they have this day of the sunlight and how to protect yourself. And so I just want to show you, because this will be gone by the time we do that on the 24th. But because of sun from many, many years ago, and if you're like my age or close to it, 10 above or 10 below, you know that we didn't always do the best thing for our skin. So with my dermatologist, if you can see these little dots here and over here, I'm doing a topical, like, chemotherapy is what he calls it. So it's a cream that you put on, and the only time these little dots will come out with that cream is if you in fact do have sun issues or spots. So
Are
this is
those?
like they're
That's what I
pre-cancer.
was gonna
They're the
ask.
pre-cancer, right?
Wow.
So they're like the flaky stuff. If you ever have that little white flaky stuff, typically that's what it is, but it'll get rid of that. But I'm going to show you guys, this is so weird, I'm not flashing you, but I just want you to see that the sun can, how it can damage your skin. So this is all that came out on my chest. I
Wow.
did not see any of that before I put that cream on there. And you put it on for like 5 days, and then all of a sudden it starts itching, and then all this come up. So this will dry up, and then it'll be gone. And then you have to be really careful and protect yourself. So
Wow.
anyway, we're going to talk about that more, but I knew that this would be gone and I wouldn't be able to show everybody. And if you're like me, you're a visual person,
Well, you know
you
what?
really
You're
like to
going
see
to
it.
show us the after photo.
That's right.
Right.
That's right.
So I think that's cool. Thanks for sharing that, because, I don't think we did do a lot of sun damage back in the day.
Yeah, we
Baby
did.
oil,
Oh my gosh.
I mean, we fried, and I actually wrecked my chest when I was in high school, and I had a huge blister on my chest and it's like, and I know that was not good. That
Yep.
was sun damage, and
Yep.
and ever since then I've been really since my 30s, I've been really good about wearing sunscreen, and
Yeah.
so it's just a matter of getting in that habit of protecting
Right.
yourself. But thank you for sharing that, Robin, because
Yep.
that's I'm sure that'll help somebody. So
Yeah, I hope so. I hope someone pays attention. Well, anyway, we'll talk about that more. But anyway, get your sleep in the meantime.
get your sleep, have fun, and live young.
That's right.
And we'll see you. I'll see you next week.
Yeah.
Bye.
All right. Bye-bye.